Today's lecture is on HIV prevention. I am Dr. Isla. There are many ways HIV infection transmission can be prevented, basically by abstinence, use of condom, not sharing needles, taking pre-exposure prophylaxis known as PrEP, and taking post-exposure prophylaxis known as PEP. Abstinence. This means avoiding all types of intimate genital contact or sexual intercourse. Someone practicing complete abstinence does not have any type of intimate sexual contact, including oral sex, so there's no risk of getting sexually transmitted diseases. Benefits of abstinence. No unwanted pregnancy, no sexually transmitted infection of any type. Having fun with friends without sexual involvement. Focusing on pursuing academic, career, extracurricular activities, and planning for a healthy future. Supporting personal, cultural, or religious values. Second preventive measure is by the use of condom. Condoms are highly effective in preventing HIV and other sexually transmitted diseases like gonorrhea, syphilis, and chlamydia. Use water-based or silicone-based lubricant to help prevent condoms from breaking or slipping during sex. Condoms help prevent HIV for higher-risk sexual activities like anal or vaginal sex, and for lower-risk activities like oral sex and sharing sex toys. Another measure is pre-exposure prophylaxis, commonly known as PrEP. The word prophylaxis means to prevent or control the spread of an infection or disease. Pre-exposure prophylaxis, known as PrEP, is HIV medication that, when used consistently, reduces the risk of HIV infection. PrEP involves taking a specific HIV medicine as prescribed to reduce the risk of getting HIV through sex or other means of transmission. World Health Organization recommends its use to HIV-negative individuals who have a significant risk of exposure to HIV infection. PrEP is highly effective and a safe additional protection. It is important to check for a negative HIV test outcome before starting with PrEP. PrEP reduces the risk of getting HIV from sex by about 99% when taken as prescribed. Among people who inject drugs, it reduces the risk by at least 74% when taken as prescribed. PrEP is much less effective when it is not taken consistently. Post-exposure prophylaxis, known as PrEP. Post-exposure prophylaxis means taking HIV medicine within 72 hours after a possible exposure to HIV. The purpose of PEP is to reduce the risk of HIV infection. PEP should be used only in emergency situations. It is not meant for regular use by people who may be exposed to HIV frequently. PEP is not intended to replace regular use of other HIV prevention methods such as consistent and proper use of condom during sex or pre-exposure prophylaxis. Now, who should consider taking PrEP? PrEP is prescribed for people who are HIV negative who may have been exposed to HIV within the last 72 hours. People can be exposed to HIV infection by coming in contact with infected body fluids like blood, semen, vaginal fluids, via having unprotected sex, shared needles, or other equipment to inject drugs or drug tattoos, sexually assault, or occupational exposure. Another preventive measure is prevent perinatal transmission. Now, how do you prevent perinatal transmission? Taking HIV medicine as prescribed throughout pregnancy, childbirth, and breastfeeding reduces the chances of transmitting HIV from mother to baby to less than 1% because the viral load will be suppressed to an undetectable viral load level. Also, giving HIV preventive medicine to the baby after giving birth reduces the chances of transmitting HIV to the baby to less than 1%. Taking HIV medicine and maintaining an undetectable viral load during pregnancy, labor, delivery, and while breastfeeding reduces the chance of transmission through breastfeeding to less than 1%. If the female individual has undetectable viral load during pregnancy and wishes to breastfeed, she can discuss with her care provider and make a plan together on the best way to breastfeed safely. But if the woman has detectable viral load, she should not breastfeed to prevent transmitting HIV to the baby. She should feed the infant with properly prepared formula or pasteurized donor human milk from a milk bank. Another measure is by protecting yourself if you inject drugs. Use of only sterile injection equipment are encouraged to prevent HIV infection. Use new, clean syringes and injection equipment every time. Never share needles, syringes, or other drug injection equipment. Dispose used needles and syringes safely according to guidelines and buy new needles from pharmacies. Protect others if you have HIV. And how do you do that? Protect others if you have HIV by taking HIV medicine as prescribed. HIV medicine is called antiretroviral therapy or ART. If taken as prescribed, HIV medicine reduces the amount of HIV in the body, which is known as viral load, to a very low level, which keeps the immune system working, prevents illness, and also prevents transmission. ART can reduce the amount of HIV in the blood, called viral load, to the point where a test cannot detect it, called an undetectable viral load. Thank you.